All right, good afternoon, everyone. Thanks again for joining for our presentation today on the resumption of Medicaid redeterminations. We'll go ahead and get started now. Just as a couple of quick housekeeping notes, we're doing this webinar style, everyone except for the co-presenters and myself are currently muted. We do have opportunities later on in the presentation to ask some questions. You can go ahead and put any questions that you'd like in the Q&A function, which should be at the bottom of your screen. You can type in questions there and the co-presenters and I will be able to see it. And we'll be holding all questions until the end. We'll go through the presentation that I'll be giving, and then my co-presenters and I will have some time at the end to go through the questions that folks ask. One other quick housekeeping note, these slides will be circulated to all attendees at the end of or shortly after the end of the presentation today. So don't feel like you need to write down every little thing that we say that's on the screen, because you'll have access to it in the future. I want to thank everyone for joining today. My name is Seamus Durak. I am a senior attorney and health policy analyst with RIPIN. RIPIN is a peer-led nonprofit that operates a wide variety of programs assisting Rhode Islanders kind of all across the lifespan. And we operate the state's consumer assistance program for health insurance issues, which is where my work is most focused. I'd like to introduce with me today our director, Kristen Souza, the Medicaid program director with the Rhode Island Executive Office of Health and Human Services. Acting director, Kimberly Brito, the acting director of the Rhode Island Department of Human Services. Director Lindsay Lang, the director of Health Source Rhode Island, and James Rajat, the Director of Strategy and Innovation at the Rhode Island Executive Office of Health and Human Services. I'll take a quick moment to go through our agenda for the day today. We're going to start off a little bit with how we got to where we are right now with the resumption of Medicaid redeterminations, what the old redetermination process was, and what we're moving back into as we resume those redeterminations. We'll do a quick overview of the renewal process as it is laid out. We'll go through the notices that folks will be receiving, kind of the order that's going to take place in, and what to expect and what actions folks will need to take. We'll talk a little bit about the supports that are in place. We'll talk about how you, as the attendees of this webinar, as folks working in this community, as folks who are just helping other individuals who are navigating this process, can assist folks both who are still Medicaid eligible and who might need some assistance walking through the steps of this process, as well as how to assist folks who need other coverage. We'll talk about what some of those other options for coverage look like. And how to obtain assistance in choosing a plan, in selecting what coverage works best for you, and identifying your options there. And then we'll conclude briefly with talking a little bit about how we as community advocates here can detect problems that might be occurring, either individually or systemically as these programs are rolled out, and a little bit on the appeals process and the resources that are available to people to assist with that. So with that, we'll start off with a quick little primer on the pandemic changes to Medicaid eligibility, where things were before the pandemic, what changed during the pandemic, and what we're moving back to now that the redeterminations are underway. To start off with a little bit of background, just because I think it's helpful context and because I know that folks have different levels of familiarity with some of these programs, I want to talk a little bit about the fact that Medicaid is not something that everyone accesses the exact same way. The program itself generally offers the same level of benefits, but the way that folks enroll in those benefits can be slightly different depending on different eligibility characteristics of that person. For example, there's the MAGI pathway that is frequently used by families that can include parents and caretakers as well as children. It includes pregnant women, and it includes adults aged 19 to 64 who are otherwise ineligible for Medicare. Now, separately from that, there's the EAD pathway. This is for elderly folks over the age of 65 or folks with disabilities. And there's other pathways as well. There's LTSS for folks receiving long-term care. There's SSI for folks receiving SSI federally or some former SSI recipients. And there's a Katie Beckett pathway for kids with significant disabilities. This is not something that you're going to get tested on. This is not to get into the nuance of those eligibility pathways. Really, what I'm trying to share here is that folks access Medicaid through a number of different pathways and the rules around each of those pathways, and thus the experience that some of these folks will have as their recertifications resume are all going to be slightly different. And recertification for Medicaid is not something new. This is something that has been part of the program for a very long time and was just suspended during the COVID-19 pandemic. Important to note, though, there is that a lot of people enrolled in Medicaid for the first time ever during the pandemic, so they don't know what the old normal was. Ordinarily, when you would have your Medicaid eligibility essentially determined in three different kind of periods. One was when you first applied. You would be evaluated then, you would be evaluated annually thereafter, and that could look a little different depending on what pathway of Medicaid you accessed. And then there was continuous eligibility verification going on. This is the Department of Human Services using the various information sources out there, computer systems that track wage data, immigration status, and things like that to determine any changes that might take place in someone's eligibility during the year. During the COVID-19 pandemic, all of that was essentially paused. The annual redeterminations were paused, the computer checks were paused, and most terminations were prohibited with some very small numbers of exceptions. Now, this ended on March 31st, 2023, and that is where we find ourselves today with these redeterminations resuming. I'll talk now a little bit about what the renewal process is going to look like, and the way that I'm planning to do this. I'm going to do it kind of three ways. I'm going to give a very quick heads up kind of overview of the notices kind of all together. Then we'll take each notice in turn. And then finally, we have a flow chart that kind of illustrates the pathway that someone can follow depending on a few different things and kind of lay it out in a diagram how someone will go through this process. Wanted to kind of do it a few different ways so folks can have kind of a tool to look back on after the training. And as I said before, these slides will be made available after the webinar is over. So as we had mentioned, the terminations and recertifications were suspended essentially during the Medicaid during the COVID-19 pandemic. That resulted in 350,000 Rhode Islanders currently with active Medicaid and 193,000 households that each must be redetermined. And that number is about 30% higher than it was in March of 2020. And because of the evolution of the COVID-19 pandemic, people moving in and out of work, getting new jobs, having all sorts of different changes happen within their households, that means that many of these current enrollees are no longer eligible for Medicaid due to income changes or due to other eligibility changes that have affected their Medicaid eligibility but have not yet been implemented. Now, beginning in April of 2023, so beginning this month, states have 12 months to begin and 14 months to conclude the financial recertifications for all Medicaid enrollees. One important caveat here is that folks who are enrolled in Medicaid through SSI are not subject to the annual recertification and will not be part of this process. So for folks who have Medicaid because of their current SSI entitlement, they will not face the same kind of process. Now, Rhode Island will split these recertifications across 12 months, starting this month, with the first terminations from the cohort beginning this month at the end of May, through the last cohort will begin in March of 2024, so March of next year, with those terminations taking place at the end of next April. And then after that process, these annual redeterminations will continue for these individuals the same as they would have previously before the COVID-19 pandemic. And renewals can essentially take place two different ways. One is called passive renewal, Passive renewal takes place for folks. It's sometimes called administrative renewal, and it takes place for folks that Rhode Island Medicaid has all of the information they need to make a determination that that person is still eligible for Medicaid. That information can come from a variety of sources. It can come reported by the individual in certain circumstances, but generally these passive renewals are going to take place when the data sources that Rhode Island Medicaid is using can look and see that somebody's income is a certain amount, that their household status hasn't changed, and that they remain eligible. Separately is the active renewal process, and this kind of encapsulates two different groups of individuals. This is called full renewal, and it's done when either Rhode Island Medicaid doesn't have sufficient information to know that someone remains eligible, or if Rhode Island Medicaid does believe they have sufficient information, but it indicates that person is no longer eligible for Medicaid. And each of these baskets of individuals will have slightly different experiences as it comes to the notices they'll receive and what the recertification will look like. We'll go through here now the various notices that people can receive, and then we'll take each notice in turn. The first notice that went out to all enrollees. This was called Notice 1 sometimes, and it was just informing all enrollees that the renewals were restarting, and requested again, as the message has been since during the COVID-19 pandemic, that folks needed to update their contact information to ensure that they would be receiving the materials from Medicaid that talked about their need to do a renewal in the future. This went out to all enrollees in March. The second notice, the special circumstance notice, only goes out to some special populations, and it talks about how those individuals are no longer eligible for the special category they were enrolled in. We'll talk a little bit more about that one in a moment. Next is either Notice 3A or Notice 3B. And going back to the previous slide, this will be determined based on whether someone is being renewed passively or needs to do a full active renewal. Folks who are going to be renewed passively will receive Notice 3A. That is a passive renewal notice, and folks who need to do a full renewal will receive Notice 3B, and may possibly also receive an ADR, an additional documents required notice that informs them of any additional information they need to provide. Notice 4 is a reminder notice that will go out to individuals who have not yet complied with the Notice 3B that requests additional information or additional documents. Notice 5 is a thank you notice that will go out to people who respond with information in response to one of these other notices. And Notice 6 is the benefit decision notice that will inform the enrollee whether their benefits have been renewed or whether those benefits will terminate. Now we'll take each of those notices individually. As I'd mentioned, Notice 1 went out to all Medicaid enrollees at the contact information that they have on file to inform them that the renewals are restarting, and that, again, requesting that they update their contact information if anything has changed during the COVID-19 pandemic. That notice has already gone out to all Medicaid enrollees. Notice 2, the special circumstance notice, that is also the green notice. It's printed on green paper. As I mentioned, goes out to some special populations. That notice, those populations include former SSI recipients who are no longer receiving SSI during the pandemic, former foster care enrollees who are no longer receiving or no longer eligible for Medicaid as a foster care enrollee, some individuals who applied during the pandemic who have non-standard immigration statuses, and folks enrolled through a flex spend down who would need to complete another or to meet another flex spend down in order to maintain their Medicaid flex coverage. These are special populations. These are smaller populations. Most Medicaid enrollees will not receive this notice. And because these special populations have special rules, for folks who have questions about their continuing eligibility, I would significantly encourage them to use community supports like navigators, or if you have particularly complex situations like RIPIN, to provide individualized assistance with identifying pathways to Medicaid access for anyone who is losing access through that pathway, or is being told that they're losing access through that pathway. Next, as I mentioned, are the renewal notices. We'll talk first about notice 3A, that's the passive renewal notice. These notices are printed on yellow paper, so sometimes they're termed the yellow notice. And it comes as a pre-populated form that includes all of the current information DHS has for this enrollee. As I mentioned, this notice goes out to folks going through the passive renewal process, so folks for whom DHS has information to indicate continued Medicaid eligibility. It includes all that information and gives the individual the opportunity to make any updates if there have been changes, but it also communicates that if no updates are made, then that person's Medicaid will continue. An important note here is that some of these notices are also being used for SNAP renewal. And so somebody could have a notice come to them that informs them that their Medicaid benefits will continue if no updates are made and if no response is given to the notice. But if that person wants to renew their SNAP benefits, they may need to renew that notice anyway in order to maintain those SNAP benefits. Some folks will not have their Medicaid and SNAP renewals take place at the same time. But for folks that are, if the notice tells them that they need to return it to maintain SNAP benefits, they will need to do that, even if they didn't need to return it in order to maintain their Medicaid benefits. And this notice, just like the active renewal notice we'll be talking about in just a second, goes out to all enrollees who are going to be passively renewed here near the beginning of the month that their cohort is up for renewal. So as I mentioned, folks are being divided into 12 groups. For the folks who are in quote unquote the April cohort, the people whose process is beginning this month, this notice will already gone out to them and should be received by now or shortly thereafter. And then subsequently for each month following, for the May cohort, it'll go out around the beginning of May, for the June cohort around the beginning of June, and so on and so forth. Now, on the other side of this is the active renewal notice. This is the yellow notice that will go out to folks who are going through a full active renewal. This similarly is a pre-populated form that includes any current information that DHS has for that enrollee. And like I said, it goes out to essentially two different groups. One is for individuals that DHS does not have sufficient information to make that renewal. In that circumstance, it'll be accompanied by an additional documents required notice informing the individual of what documents are required in order for DHS to make that determination. Separately, it can also go out to individuals for whom DHS does have information to make a determination currently, but that information indicates that person is no longer eligible for Medicaid. This will give that person the opportunity to make any of those changes on the form to show that they are in fact still eligible and return that notice in order to be evaluated along with any supporting documentation. Similarly, this one can also be used for SNAP eligibility and for a SNAP renewal and goes out around the beginning of the month that the cohort is up for renewal. And for folks that receive both the Notice 3B active renewal notice and an ADR, it's important for them to return both of those notices together in order to be reevaluated. The fourth notice is kind of simple. That's the reminder notice. This goes out to folks who receive the active renewal who do not respond by the deadline on that notice. It'll essentially give people a little bit longer. It'll tell them that a response has not yet been received and give them another deadline to provide the information that's necessary. Notice 5 is a thank you information received notice that'll go out to anyone once a response is received to one of the renewal notices or to the reminder notice if they missed the first deadline that's on the renewal notice. And then finally is the benefit decision notice. This will go out to individuals to inform them whether their Medicaid benefits are renewed or whether they are terminated. And if they are terminated, it will inform the enrollee of other potential coverage options, including whether they have been automatically enrolled into a qualified health plan through the auto enrollment process we'll be talking about a little bit later. As I mentioned, we'll go now quickly through a graphical representation of this in case that's helpful for folks, and this will come out in these slides that will circulate after the webinar. As I mentioned, the first notices that folks receive are the first notice, the one that informs people that renewals are beginning. And then some folks will receive this special population notice if they're part of those special populations. Otherwise, the next notice they'll receive around the beginning of the month in which their cohort is up for renewal is a renewal notice. We mentioned that can be a passive renewal notice. That's when DHS has information to determine eligibility based on the data that they have already received. And it gives people the opportunity to either not report changes or to report changes if there have been any changes since the information that is on the pre-populated form. If the individual does not report any changes, then they will receive a benefit decision notice approving Medicaid. As I mentioned before, for folks who are having a simultaneous SNAP renewal, they may have to return that form in order to maintain their SNAP benefits. But even if they don't, they will receive a benefit decision notice approving their Medicaid because the information that DHS is relying on indicates that Medicaid eligibility. If they report changes, they will receive the thank you notice, and then depending on whether the changes they report mean that they remain eligible or are no longer eligible, they'll get a benefit decision notice telling them either way, either that their benefits remain approved or that their benefits have been terminated because their eligibility has changed and they are no longer eligible for the benefits in which they were enrolled. If they are not eligible for the passive renewal process, they'll receive an active renewal notice. That can possibly be accompanied shortly thereafter by an ADR, the additional documents required notice. And here they, in order to maintain their benefits, they will need to submit the documents to show either the information that DHS does not have or that information that DHS does have is incorrect and that their eligibility should be maintained. If they submit those documents, they will similarly get a thank you notice. And then a benefit decision notice acting on the information that was provided, either approving their Medicaid benefits to continue or terminating them if they are no longer eligible. If they do not respond to the active renewal notice and the ADR, they will receive a reminder notice that will give them a new deadline by which they need to submit those documents. And then if they then submit the documents by the date on the reminder notice, they will get the thank you notice and a benefit decision notice evaluating their eligibility and either approving them for continued benefits or terminating their benefits. And then if they do not respond to the reminder notice and thus have not responded by the final deadline for their cohort, they will receive a benefit decision notice terminating their Medicaid because they had not provided the response that was required to complete the recertification. We'll talk now a little bit about when these renewals will be taking place for different populations. As I mentioned earlier, most adult enrollees will be divided into 12 cohorts or groups. These are kind of monthly teed up with renewals starting every month from this month, from April of 2023, all the way until March of 2024. And within these cohorts, it's not as though everyone is being done alphabetically or based on certain characteristics. There are folks from all of these different groups that will be in each of these months. There are some important considerations here, though. Households with children will not begin receiving the renewal notices until December 2023 at the earliest. So any household that includes children will be in one of the last 4 cohorts. These are the December 2023, January 2024, February 2024, and March 2024 cohorts. So those folks should not be renewed until later on in the process. And this includes households both with children who are enrolled through the Magi pathway, through the family pathway, or households that include Katie Beckett children. Those are the children with significant disabilities who have a special pathway available to them. And then in March 24, these initial redeterminations and renewals will conclude. And then from that point forward, renewals will take place annually as they normally did thereafter. And how can somebody know when their renewal is going to take place? There's essentially 2 kind of pathways out there that are there to help people have that information. One is that if you log into your customer portal, that will include for most enrollees the month in which they will be re-enrolled, with one significant exception, which is that those Notice 2 populations, the special populations that have some particular special characteristics and are enrolled through a special pathway, they may not have the renewal date available in the customer portal. But most enrollees will have that information available. And then separately, Managed care organizations, these are Neighborhood, United, and Tufts, the carriers that provide Medicaid benefits to the vast majority of enrollees will have that information. Neighborhood Integrity, the program for Medicare Medicaid duals, will have that information. Some dual special needs plans will have that information, and some care management providers outside of those managed care organizations will have information about when their enrollees are scheduled for renewal. So if you are someone who is enrolled in care management and you have a care manager, your care manager may very well have the ability to provide you with the information as to when your renewal will take place. I'll talk now a little bit about the ways that folks who are still eligible for Medicaid can get assistance from the community, and how you as community members and community partners can provide that assistance to the community. And then we'll move on briefly to talking a little bit about ways that folks who are no longer eligible for Medicaid because of an eligibility change during the pandemic can maintain access to the healthcare services they need. So many, as I mentioned earlier, many Medicaid enrollees have had eligibility changes during the pandemic, but many others have not. Many others remain eligible in the category they were previously eligible through. That can be through the MAGI pathway, that can be for families or individuals, adults who are below the Medicaid income limit for an adult. It could be for elders or disabled individuals who receive Medicare. And many of these people will be passively renewed. If DHS has the information on file to show that they are still eligible for that category, they should receive the passive renewal notice and not need to report any additional information in order to maintain their benefits. Now, for some of these folks, there might have been changes, but they still remain eligible in that category. And if DHS doesn't have that information available, they'll receive the active renewal notice, and it's important for them to respond on time to that notice and get any assistance they need in filling out that paperwork in order to maintain that eligibility. It's important to do that on time to maintain active coverage through the renewal process. Now, some other individuals may still be eligible for Medicaid, but are no longer eligible for Medicaid in the category they were enrolled in at the beginning of the COVID-19 pandemic or when they first enrolled. There's a lot of examples of this. There's a short list here of some potential examples that could include individuals who turned 65 during the pandemic and are no longer eligible for MAGI adult Medicaid, but are now eligible as through the elderly and disabled pathway. Similarly, it could include somebody who has received SSDI for more than 2 years and is thus eligible for Medicare and must go through the elderly and disabled pathway. It can include folks who are newly pregnant who need to report that information to DHS. It could include people who are newly parents, or it could include people who have turned 19 and are no longer children, but must enroll through the MAGI adult pathway, or as an elderly and disabled person if they have a disability and are receiving SSDI. Some of these individuals may be transitioned passively if DHS does have that information on file, but many more of them will need to provide additional information in order to maintain their coverage. And so that kind of takes us to one of the central questions here, which is what assistance can we as community partners provide, and what assistance is available for these enrollees? Now, many of the folks on this webinar today are the sort of helpers. We call ourselves helpers sometimes. You can either be a helper because you are working with this community directly on a day-to-day basis, or you're living with this community, or you're living with somebody who is enrolled in Medicaid, or you're just friendly with them and you help them fill out paperwork. And that network is really important. And there's some really important things that we can be doing to make this process move more quickly and more smoothly. That can be just as simple as telling people to open the envelopes they receive and make sure they're responding to these notices, helping people upload their documents, using the mobile app to upload documents potentially, using the mobile app to see information in your customer portal about when things are going to be taking place. You can help inform people or provide access to the DHS scanning center where folks can upload documents that they need to upload without having to mail them in and wait for a response and worry about making copies, and connecting people to other community assisters to provide more intensive support when folks need help. Next, we'll talk a little bit about some options that are available to people who are no longer eligible for Medicaid. As I mentioned, a lot of people have had an eligibility change during the pandemic, and because of this, they'll need to find coverage through another pathway because their Medicaid benefits will end. Now, most, if not all of these people will have access to another form of coverage that they can seamlessly transition into, but it's going to look different depending on what that person's experience is and what their circumstances are. These can include things like employer-sponsored insurance through your job or through a family member's job. It can be Medicare without continuing Medicaid coverage for people who have newly become eligible for Medicare or whose income has changed. And it can be a qualified health plan through HealthSource Rhode Island, potentially with auto enrollment or with financial assistance to make that coverage more affordable. I want to first talk about employer-sponsored insurance because for a lot of people, it's going to be their only option. And it's something that I think that it's really important that we maintain knowledge about because a lot of the materials that folks will be receiving will not mention it because frequently DHS and Medicaid don't know about the options that someone might have access to through an employer. Many individuals who received Medicaid during the pandemic and who are currently employed have offers of coverage either through their work, or if you're the child or spouse of somebody who receives an offer of employer-sponsored coverage, you might be eligible for that coverage as well. And in a lot of circumstances, if your income's too high for Medicaid, this is really your only option. You're not going to be eligible for financial assistance through a qualified health plan if you are offered affordable employer-sponsored insurance through either yours or a family member's job. Now, there's some kind of more technical things going on here. The family glitch has been fixed, and the coverage does need to be affordable for you as an enrollee in order to not be eligible for that assistance. But for most people who have coverage through their work, this is going to be the best option, and for many of their family members as well. Now, for folks who are having specific issues with questions about this, there are a number of resources out there to provide assistance, including the Navigator Network and including RIPIN, who can help look at whether somebody needs to take this as an option. But if you are offered it, it's frequently going to be your best and maybe only option to receive health insurance. Second is Medicare. For a lot of folks, over 3 years, people have aged, people have gone onto or hit a certain period of time on disability and have become eligible for Medicare. And the Medicare eligibility pathway, the Medicaid eligibility pathways for individuals enrolled in Medicare are slightly different than they are for an adult who is not eligible for Medicare. Elderly and disabled Medicaid has a lower income threshold and includes a resource threshold where you have to have resources, bank account information, or bank account resources, or other kind of resources below a certain threshold in order to maintain your eligibility. And this means that because of that change in the way that you have to access Medicaid, some people who turn 65 or begin receiving Medicare because of disability are no longer going to be eligible for Medicaid and must instead use Medicare as their main coverage. They may be eligible for a program called the Medicare Premium Payment Program to help with some Medicare costs. But it's important to know that if you are offered Medicare, you are not eligible for financial assistance or auto enrollment with HealthSource Rhode Island and should not enroll in a qualified health plan because it's frequently it's not an option for you and would not provide the coverage that you would need. Now, for folks who are not eligible for employer-sponsored coverage and are not eligible for Medicare, a qualified health plan with HealthSource Rhode Island is going to be a good option frequently for you. For the folks who are losing Medicaid due to their income now being slightly over the limit, there are additional supports in place. These can include one that is available very broadly. That's the added financial assistance that's been available federally for some time now that includes additional tax credits to make coverage affordable for a larger number of Rhode Islanders. but also includes some Rhode Island specific programs, including for individuals below 200% of the federal poverty line. That's about $55,000 for a family of 4, $27,000 for an individual. Those individuals will be automatically enrolled in a neighborhood value plan and have their first 2 months of premiums paid for by HealthSource Rhode Island. And people below 250% of the federal poverty line, that's about $69,000 for a family of 4, or $34,000 for an individual, will not be automatically enrolled, but they are eligible for state premium payment if they choose a plan. Talking a little bit about the individuals who will be automatically enrolled in the neighborhood value plan. Those individuals can choose a different plan. That could be a plan that provides a higher level of benefits in exchange for a higher monthly premium, or a lower level of benefits in exchange for a lower monthly premium, and still retain the 2 months of premium payment. And it can also include a plan that provides abortion coverage, as the neighborhood value plan does not include abortion as a covered benefit, in which case somebody can switch into a plan and they may have a small additional monthly premium, but they would still be eligible for state payment of the majority of that premium for those first 2 months. There are many options for community assistance in evaluating plan options. For folks eligible for qualified health plans, they can receive application assistance from certified application counselors, and they can receive assistance in both applying for and choosing a plan that works for them from HealthSource navigators. For folks eligible for Medicare, they can receive assistance in selecting a Medigap plan, a Medicare supplement plan, a Medicare Advantage plan, a Part D plan, or choosing Original Medicare from a SHIP counselor as well. I'm going to take a couple of quick little examples, and then we'll conclude, as I mentioned, with some additional information about detecting problems, and then we'll have some time for questions. These examples are relatively straightforward, just kind of meant to illustrate a potential scenario that someone might find themselves in. So the first example we'll take is Robert and his family. Robert, his wife Jill, his kids Bob Jr. and Josie, they all had work coverage through Robert's job, until he lost his coverage in April of 2020. When he lost his coverage, the family applied for Medicaid, has been enrolled in Medicaid since then, but back in 2021, Robert's job hired him back, gave him his health insurance benefits back, and gave the household an annual income of $175,000. No tests here, that is over the Medicaid income limit. So you might wonder what's going to happen as this process begins. Robert and his family are no longer eligible for Medicaid. They are offered coverage through Robert's work. They should enroll in that coverage if they have not already. Once they go through the renewal process, they will receive the active renewal information. And if they don't make any corrections, which at this point there aren't any corrections to make, they will be terminated at the end of that process. And at that point, if they have not yet enrolled in Robert's work coverage, they would have to enroll in that coverage in order to maintain health insurance coverage. Now, separately, let's take the instance of Stephanie and Amelia here. Stephanie and her daughter Amelia are currently enrolled in Medicaid as a household of 2. Stephanie makes $2,250 a month. That is below the income limit for both parents and children. And Stephanie here submits her recertification on time. So there's no issues around not responding timely to the request for recertification. Here, Stephanie and Amelia are both eligible for Medicaid. They'll receive a benefit decision notice extending their benefits so long as they respond accurately and on time. But if their income and household changes in the future, that could affect their future eligibility. If Stephanie gets a job that pays more, or if Amelia graduates and goes off to college, depending on what that impact that'll have, they may or may not maintain Medicaid benefits in the future, but that's down the road. The last couple things we'll talk about here, a little bit about detecting problems and wrongful terminations. We know that no matter how well any system is built, there will be issues that appear and folks that have experiences they should not. And some of those issues are going to be consumer specific. That could be because incorrect information was provided, or because the information that was correctly provided is just not correctly processed. That's always been something that takes place. And there are guardrails in place, including organizations like RIPIN that can provide assistance to walk folks through that process. Now, separately, though, because we are now going back into Medicaid redeterminations for the first time in 3 years, we want to be cognizant of the potential of any systemic or problematic trends that reflect a broader system issue where groups of people are having a similar experience that is wrongful, that we as community advocates can kind of act as a place that can centralize that information and report back to our partners at the Department of Human Services or at Rhode Island Medicaid or at HealthSource Rhode Island about any potential issues there. And those kind of consumer resources include people like navigators, the certified application counselors, the SHIP counselors that provide assistance specifically for folks navigating the Medicare world and choosing Medicare plans or getting assistance with elderly and disabled benefits. And then organizations like RIPIN kind of as an escalation resource that can provide on the ground assistance in helping those folks with individual issues, but also in diagnosing when we're seeing the same issue multiple times that might be reflective of a broader trend. For individual problems, that can be frequently resolved most easily simply through quote unquote reapplying. That could be just calling HealthSource Rhode Island. If you're eligible for MAGI and you get terminated, but you're still eligible, you can call back, provide that information, and potentially be re-enrolled. Or if somebody has not sent in the renewal form on time, they have to send it in late, they might get terminated at the end of the 2-month renewal window. But if they send in their information late, within 90 days of their termination, DHS will reprocess that application. They won't have to do a full new application at that time. And if they remain eligible at that point, they'll be re-enrolled as of that month. And then there are community supports out there for a variety of people who believe they were terminated incorrectly. That can be anywhere from escalating potential issues up through DHS, through EOHHS, and through HealthSource if an enrollment has gone through improperly, or up to assistance with on-the-ground appeals. And there are various organizations out there to provide that assistance, including RIPIN and Rhode Island Legal Services, that can be contacted if you believe that you have a particular appeals issue and you need assistance with that. One thing to keep in mind there is that these appeals are time sensitive. You only have a certain amount of time after you receive a termination notice in order to file that appeal. So don't delay. If you are terminated and you think that it's been wrongful, you need to reach out for that assistance right away so you don't miss out on the opportunity to push forward with that case. With that, I think we've got about 15 minutes for questions, and I'll open it up as well to my co-presenters, Directors Souza, Director Brito, Director Lang, and James, if any of you have anything right off the cuff that you'd like to include.
Thanks, Seamus. While folks are getting ready to ask their questions, I'd be happy to just jump in with a couple of pieces I wanted to add to your very comprehensive presentation. Thank you for all of that information. You did a great job, and certainly make our job today a very light one. I did just want to stress the affordability piece around families' access to employer-sponsored coverage. Affordable in air quotes, that's a federal definition. The threshold did recently come down to 9.12% of a family's household income. We have a tool on our website, which I will drop in the chat if I'm able to, that helps folks understand whether that coverage is affordable to the household or not, so that they can weigh their options of accepting that employer-sponsored coverage or enrolling through HSRI with federal financial assistance. Another piece is for folks who are looking for their renewal date. They can also do that through the Healthy Road mobile app. That's an additional avenue for folks to get their renewal date. And then I think you had very helpfully added some channels to get assistance with plan selection. The CACs are great. The navigators are a wonderful resource. You can also call HealthSource RI from 8 to 6 p.m. And our representatives are trained in helping people pick a plan that best suits their needs. So it's wonderful to go to somebody who's in your community. You can look on our website for someone nearby who also speaks the language that you're most comfortable speaking. If you'd like to call HSRI, you can also do that. And we have language services available. So thanks for letting me add those few tidbits.
Thanks for that, Director Lang. Do any of my other co-presenters want to, Director Brito?
Hi, everyone. I would like to just emphasize the use of our new document scanning center. We have nothing but positive results from members who go in there. We are seeing sometimes up to 300 folks a day. They're able to come in and exit in less than 10 minutes, the entire exchange. A lot of times the verifications that are being dropped off, they're scanned into the system directly, handed back to the customer. They use that as their receipt, but it's a very quick exchange. It has a lot of efficiencies to it. And the best part is that those verifications are directly in the customer's accounts, which on the back end, the workers are able to access in that moment. So it's helping in terms of timely processing. So I just wanted to emphasize that. And of course, the use of the customer portal and just the technology platforms that are in place to help expedite and keep folks proactively informed.
Hi, everyone. Kristen here. Just want to express gratitude to RIPIN and Seamus in particular for hosting this event and a very comprehensive presentation, and gratitude to all of you in all that you do for us every day in helping our beneficiaries and getting the word out as we go through this process over the next year. We really appreciate that, and it does not go unrecognized that we do not do this without you. And so just wanted to make sure that everyone was aware that we are all very grateful for the engagement and for all the participation we have seen both here today and all of the presentations we have done to date, and hope that that will continue through this process. So thank you all.
Great, thanks for that. And I think we've got a little bit of time for some questions, so I'll just go through what we've had submitted and pick a few of those. And then, as I'd mentioned earlier, there are a number of resources out there for further assistance. So if you feel that you have further questions or things that come up later on, feel free to reach out to us or to turn for assistance to the Navigator Network, the certified application counselors, the SHIP network, wherever that might be. And we'll make sure to update on that. The first question here, will a reminder notice be sent to active renewal individuals who do not get an ADR, even if they have not submitted the signed renewal form? I don't know.
So reminder notices will go out to folks that don't submit documents. Not sure if that answers the question, but there will be a reminder notice that goes out if we do not receive the information prior to any adverse action being taken. Director Brito, anything to, okay, James.
Yeah, so the reminder notice is specifically for those who received an active recertification notice, that they have an active renewal, that they have to do something, submit something in order to make a change. If all of what is needed has not been received within a certain window of time, approximately 30 days or so, since there's a 60-day window, those notices will be sent as a reminder. prior to hitting the 60-day mark. So that is the intent of the notices. We will rely on you as community partners to help and tell us if, for example, that's not happening the way we anticipated and programmed it with the technology, but that is our hope and that is the plan, and look forward to finding out if there are any nuances. Again, we are learning each and every day as we implement this process, if there are changes that we need to make or validation that needs to be done in the event that something new pops up. So you are the eyes and ears in the field. So to Director Suda and Director Brito and Director Lang's point, thank you. And we'll continue to monitor this with you all as we go through the next 12 months together.
Great, thanks for that. Next question. Is there a number at DHS, or maybe kind of more broadly, is there a good pathway to follow if somebody says that they have submitted documents, but they do not receive the thank you notice saying they were received?
So the number, we don't have an additional phone number, but we would encourage folks to call DHS main call center line. Folks can also call HSRI to see if verifications have been received, or again for assistance there. But there is not a separate phone number. So it is the main DHS line. Folks can log into their customer portal to see if those verifications are in there. There's a way to triage, and or plus if they have downloaded the mobile app, to use that as well to see if the verifications have been received.
Great, thanks for that. We referenced the customer portal several times. Can we provide links or references to that? Yes, we can provide links and references in the materials that we will be circulating after this on how to access that. As I mentioned earlier, we will provide the slides as well. We'll provide some other resources from our partners here and a link to the statecovered.rhodeisland.gov site that has a bit more information about some of these notices, and kind of will be continuing to build information as the process continues.
And Seamus, I'd like to add right there on the DHS website, there's a tech resource page, which really has some great information about how to set up a customer portal account, how to reset passwords, those types of things. So they're on the DHS website now as well.
Great, yeah, we can definitely include a pointer to that when we send out that information. So we'll make a list of the things that we will be circulating, and that'll go out to everyone who registered for that. So even for folks who were not able to make it today, they'll receive that information. And we will have a recording of this training as well available on YouTube if anyone is just really itching to go back and listen to me talk for another 45 minutes at some point in the future. Question, where is the document scanning center?
Right now, we have one, and it's at 1 Reservoir Ave in our DHS field office location. We will soon have 3. So we'll have the 1 Reservoir Ave, our Pawtucket office. We're adding a document scanning center there, and then our new Providence field office, which we're slated to move into at the end of June. So 1 right now at 1 Reservoir Ave in Providence.
Thanks for that. This is one I've seen a few different places, and I'll start with some recommendations here, but I'm happy to turn it over to others as well. What are some suggestions for individuals who do not have access to email or technology? I think that's a great question, and it's one that I think that is really central to a lot of our work. And it kind of depends on what help you're needing, or what your situation is. If you need assistance with submitting documents, as we mentioned, there's the scanning center, which is a great resource, which was created in large part, to my understanding, to help assist folks who have limited access to technology, but want to be able to kind of wash their hands of it in one day and not have to wait for a response to a mail, don't have to worry about making copies. So that's one potential resource. Other resources, one that I would be remiss in not mentioning, is libraries. A lot of libraries have reached out to us and to other community partners to kind of provide that on the ground assistance. They have that technology, they have staff who care about their communities and want to provide that assistance. I think we have some folks from a number of libraries who are in attendance today. So reach out there, and that's a potential resource at the very least for using technology, but potentially for more assistance. There's the navigators. Navigators are great to sit down with and be able to kind of walk through that process. You can have an in-person appointment set up there. And then there's other resources. There's potentially the resident services coordinator at a building. I think maybe my ask to all of you who are in attendance today is, if you're providing this assistance, make yourself known. Hold yourself out as somebody who, even if you don't know the intricacies of Medicaid eligibility, because no one needs to have that level of expertise in order to provide assistance, just be available as a resource to kind of help folks connect with the partners that do, or just provide the on-the-ground assistance of helping someone make a phone call or submit a document or scan a document or use the mobile app. But I'll open it up to anyone else who wants to add on that.
Hi, it's Kristen again. I think that we also have been going out and educating our senior centers, who are a great resource, particular to our elder population. I know that there's been a concerted effort to do faith-based organizations. I think that there's a lot of community presence out there who are willing to help. So we would encourage community, contacting your local community organization to assist if you have no access to technology. Those are other areas that I know that are willing to help and have engaged with us as we go through this.
And I can just add that coming, soon will be an announcement of the awards of our mini grant submissions. And in that, we are providing resources for, items like as tech that can be used in the field to support the clients that you serve across the various organizations in our state. And one reminder that if I may plug is everyone's trusted network of support is different. And it's really critical that the key messages, particularly for those who rely on others, whether it's a caregiver, whether it's a case manager and others, know to have this conversation about updating their information, about checking their mail, and about the supports that they may need to submit information or gather information. And we rely on you to help be that glue across organizations as we do this as part of what I would call care coordination, which ensures and starts with making sure folks have coverage. And so as much as you can do with your existing coordination and connections, and encouraging and understanding families' networks to understand, well, who do you have help you with your taxes, for example, is a question that can be asked, and think about, well, might they help support you through this process as well? Those are the types of outreach that we really need you all, and we are asking our community partners to do, in addition to the additional equipment and supports that we're hoping to provide shortly.
Great. We might have time for one or more, and this is a good one, I think, that is going to be helpful for a lot of people. If an individual is no longer eligible for a Medicaid and has access to insurance through their employer, so is probably not going to enroll into a QHP, yet can only access employer-sponsored coverage during the employer's open enrollment period, would they be able to access Medicaid or QHP until the employer's open enrollment becomes available? I think that's a really good question and something that's on a lot of people's mind. I can take a very quick stab, and then Director Lang, if you'd want to jump in on that, or anyone else. Generally, you'll have your open enrollment period through your work, but you should also be eligible for what's called a special enrollment period if your circumstances change. And that should include the termination of Medicaid benefits. So somebody who loses Medicaid benefits should be given the opportunity to enroll at that point in time through their employer's coverage. Now, that's something that we also anticipate could be a sticking point for, we've faced issues with that as RIPIN assisting consumers in the past. So feel free to lean on community supports or reach out to us directly for that sort of assistance. If you're working with a client who is eligible for employer coverage, but is being told that because it's outside of the open enrollment window, they're not going to be allowed to enroll at that time. And then Director Lang, I don't know if you wanted to address the kind of the other half of that about access to other benefits if you are not being offered employer coverage at that time.
Sure. So if you're not offered affordable employer coverage, or somebody else asked about, sometimes you encounter a 1-year waiting period or a couple of months waiting period when you first come onto the job. That's a great time to go through Health Source RI, and that's sort of exactly what many people use Health Source RI for, which is those short gaps in coverage. And you can always call us and ask us and walk through that scenario, and we'll help you figure it out. The SEP that Seamus mentioned is spot on. It's helpful to remind people who do have employer coverage that that's an option that they should be entitled to through their employer coverage. I also want to just plug that Health Source RI is opening up a special enrollment period for coverage through HSRI that someone can kick off, can sort of invoke or begin at any point in time during this special redeterminations period. So in addition to having a special enrollment period, once you lose your Medicaid, so 60 days from when Medicaid ends, you can also come to Health Source RI for this entire year that redeterminations are beginning again, and let us know that you lost Medicaid at some point in time during this year and kick off a new 60-day SEP. And that coverage would be prospective. It would be going forward for the first of the month following the month that you enrolled in. So that's an additional way that we're just working to make sure that people have the option to come through Health Source RI if they do end up losing their Medicaid.
All right, well, thanks for that. And thanks everyone for taking some time out of your afternoon to spend with us and talk through this. We anticipate, RIPIN anticipates providing continued coverage around some of this as we move forward into the resumption of renewals, potentially including more information in the next month or two as we're seeing kind of how the process is working out on the ground. And certainly another version of this webinar near the end of the year as we're getting into supporting the families with children who will begin the renewals around that point in time. In the meantime, you know where to find us. RIPIN's phone number is going to be on the material that we'll be sending out momentarily, but we are 270-0101. We'll make sure to include these slides and the additional information we've talked about. And I guess I'll turn it over to my co-presenters if anyone has any parting thoughts. Thank you all for your participation this afternoon.
Glad to be here.
Thanks, everyone.
Thank you.
Yes, thank you.
Be ready, stay covered.
That's it.
There you go.
Perfect.
Take care.
Bye.